Today's video we're going to cover if you've already had surgery and your knee is still in pain. Now that could be had ligament surgery, ACL, MCL, PCL surgery. It could also be you've had meniscus surgery. You can have full-blown surgery on your knee, or you can have just had like a keyhole arthroscopic kind of surgery as well. And I wanted to explain to you today the dynamics of what's going on in your knee and why it still hurts. Whenever you experience pain in your knee, no matter what it is, and at this point, remember, if something is broken or torn, you've already got that cleared with the doctor. So nothing is broken or torn, and mechanically your knee is fine. However, nothing is showing up on an x-ray, a CT scan, or an MRI. You've already had that repaired. What happens is, when your knee hurts, from a fundamental level, looking at what pain is, you have nerves in your knee that are being squeezed upon, that's sending a signal to your brain that you have knee pain. And what happens is when we experience a surgery, when we experience an injury, and then a surgery, of course, which kind of compounds the problem, the nervous system, your nervous system, tenses up to protect itself from getting injured further. It's just a natural response your body has to pain, whether or not you're consciously awake. Your nervous system will tense up to protect itself from getting injured further. This is functional for an injury. It's dysfunctional for you to walk around without having problems with your knee. So when you have the ligament surgery, the meniscus surgery, whatever it is, you fix the mechanical dysfunction. However, the neurological dysfunction is still there, meaning your nervous system is still tensing up because it's going to hurt, which makes it tense it up more, which makes it hurt more, which makes it tense up more. So it kind of gets to be a downward spiral. What I would suggest for you to do, your highest leverage thing to look at in terms of addressing what's going on with your knee, would be to get into my virtual clinic and focus on a section that I call the stretching lounge. So you would get into my virtual clinic, get into the stretching lounge, and go halfway down to a section that I refer to as the passive stretching section. And the passive stretching section is all about creating comfort in your knee joint, which takes the pressure off of the nerves in your knee. And when the pressure is off the nerves in your knee couldn't possibly hurt. That begins to set up the conditions so your body can heal what you have going on with your knee pain. So what I'm going to do is put a link down below this video, and it's going to be to my virtual clinic where you can sign up. It's a monthly membership program, and based on the emails that I get from you about what you notice and how it changes and shifts in your knee or in the rest of your body, the tension as a result of your knee bothering you, I create more videos to put in the virtual clinic that causes the virtual clinic to grow. So there's a lot of stuff in the virtual clinic, and you're welcome to look at all of it. However, in terms of your highest leverage thing right now, already having had the surgery with your knee, is to get in there and focus in the stretching lounge, in the passive stretching section, watch the intro video, and then find out exactly where your knee hurts, because I have descriptions of all of it, and do those passive stretches, which is going to take that pressure off of the nerves in your knee and begin to set up the conditions so you can begin to do what you want to do and not think about your knee anymore. So go ahead and do that now. If you do have further questions, I'm always available for a knee freedom strategy session. I'll leave that link below as well. And that's where we can get on a 25-minute call and figure out an exact strategy, and I would specifically point out the videos in the virtual clinic that would give you the highest leverage activity for you to get out of chronic knee pain today. So, thank you so much, and I will be in touch soon.